Why is Ewing sarcoma difficult to diagnose correctly? Imagine trying to find a tiny needle in a huge haystack. That's similar to how doctors sometimes struggle to correctly diagnose Ewing sarcoma. This cancer is tricky because its signs and features often look like other bone and soft tissue conditions. For example, it can mimic infections like osteomyelitis or other small round cell tumors, which makes it hard to tell them apart just from symptoms or initial scans. Patients often come in with vague complaints like pain or swelling that don't point directly to cancer. Sometimes there's no injury or obvious cause, so doctors might first think of common issues like muscle strains or arthritis, especially in older adults. This can delay suspicion of a serious condition like Ewing sarcoma. Diagnosing this cancer also involves complex genetic testing. Ewing sarcoma has specific genetic changes, like rearrangements of the USAR1 gene and certain gene fusions. But these genetic markers aren't exclusive to Ewing sarcoma and can appear in other tumors too. So, pathologists need to carefully interpret these results, often using additional tests like immunohistochemistry to look for specific protein expressions. This process requires specialized labs and expert knowledge, which might not be available everywhere. Another challenge is that Ewing sarcoma mainly affects children and young adults, so when it appears in older adults, it's even less expected. Doctors might not think of it right away, leading to further delays. Plus, the common tests used to detect genetic changes sometimes only identify the presence of USAR1 rearrangements, not the exact fusion partners. This can cause confusion with other tumors that have similar genetic features but are different diseases altogether. Because of all these factors, diagnosing Ewing sarcoma often involves ruling out many other conditions. It requires a team approach, combining clinical exams, imaging scans, tissue biopsies, and advanced genetic tests. Sometimes, initial results are inconclusive, and doctors need to reevaluate or perform additional testing. This process can take time and may require referral to specialized centers with experience in bone cancers. Understanding these challenges helps us see why early and accurate diagnosis is so important. When caught early, treatment options are more effective, and outcomes can improve significantly. But the complexity of its presentation and the need for sophisticated testing make diagnosing Ewing sarcoma a real puzzle that only experienced specialists can piece together confidently. Always remember, if you or someone you know has persistent bone pain or swelling, consulting a healthcare professional for thorough evaluation is essential.